So let's compare the basic aspects of Medicare and Medicaid and see if we can determine which is which. To begin, let's consider the similarities. First, both programs were made part of the Social Security Act by the 1965 Social Security Amendments. Medicare enacted as Title 18 and Medicaid as Title 19. Secondly, both programs have a primary function of financing all or part of hospital costs, physician costs, and other health care costs. Next, both programs rely heavily on federal funding. Another similarity is that both are concerned with promoting a health care delivery system that is cost efficient, of high quality, and free of program misuse. Now, how does Medicare differ from Medicaid? Well, first, Medicare and Medicaid differ in the way they're administered. Medicare is administered totally by the federal government through contracts with various private insurance companies and state agencies. Now, because it's totally a federal program, Medicare is uniform throughout the country. Medicaid, on the other hand, operates on the basis of a state-federal partnership. Each state develops its own individual program within broad federal guidelines. The Medicaid program is then administered through its Medicaid state agency. Now, because it is state-administered, the scope of Medicaid benefits varies from state to state, but each state must provide certain required services to participate in the program. Medicaid, on the other hand, covers certain groups of low-income people who need assistance in meeting their medical expenses as defined by the state they live in. To be eligible for Medicaid, the applicant must fall into one of four groups. 1, needy people 65 and older. 2, the needy blind. 3, the needy disabled. And 4, members of certain needy families with dependent children. So Medicaid eligibility is related to a person's financial need. Medicare eligibility is not.